Good morning, Ms. Birch.
Good morning.
My name is Eli. I'm a nurse practitioner student with VSU. Today I'm going to be doing a full head to toe physical exam on you, okay? I'm going to raise the bed up to a little more comfortable working height. We're going to start with your head, ears, eyes, nose, and throat, okay? So the first thing I'm going to do is just look at the general symmetry of your skull and your facial features. Okay, I'm going to be looking for any abnormalities in the skin, looking for normal color, for your ethnicity, temperature, mobility, and turgor. I'm looking for any swelling, any abnormalities, any lesions, scars, bruising, nevi. I'm going to ask you to tilt your head forward. I'm going to do the same thing and just kind of part your hair and look at the scalp, looking for infestations. I'm going to kind of palpate around for depressions along the suture lines, looking for any abnormalities or evidence of trauma of the skull, of which I see none. Okay. The next thing I'm going to do is I'm going to palpate here at your temporal arteries. Tell me if that's tender.
No.
Okay. And now the frontal and maxillary sinuses, is that tender to you when I press into these areas?
No.
Okay, very good. I'm now going to move your hair back slightly. I'm going to start to feel for your lymph nodes. Okay, first I'm going to feel back here at the occipital lymph node. Okay, and then the post-auricular here. I'm just going to feel around in each of these areas. Pre-auricular. Okay. The tonsillar region here, the tonsillar nodes. Submandibular. Okay, and then submental here at the tip of the chin. Going to feel back here at the posterior cervical chain, anterior cervical chain, and then supraclavicular nodes I'm going to feel. Okay, and I feel none of those are palpable, no evidence of swelling, so that's a normal finding. Okay, now I'm going to be looking at your eyes. First I'm looking at the external structures, the lashes, the eyebrows, the palpebral fissures here. I'm looking for any lesions or nodules, normal hair growth here. Then I'm just kind of visualizing the sclera, the white of your eyes, looking for any abnormal color or any discharge, any foreign bodies, okay, of which I see none. The next thing I'm going to do is a pupillary response. So first thing I want to do is I want you to just look straight at the tip of my nose and tell me when you see my wiggling fingers enter your peripheral vision, okay?
Now.
Okay.
Now.
Okay. What about down here?
Now.
Okay, very good. Now I'm going to do a pupillary response. First thing I'm going to do is ask you to just hold your eyes open wide and look at the tip of my nose still. I'm going to use this pen light to look for a direct and also the consensual or the opposite pupillary response. Okay, very good. I'm going to toggle back and forth. I want you to hold these eyes open wide. Okay, very good. Okay. Now, if you can, I want you to look at that outlet on the wall behind us, okay? I want you to switch from looking at that and then looking at my finger, okay? Back to the outlet, to my finger, and again to the outlet, okay? Now, if you will, look at the tip of this pen light. I want you to focus in on it as it moves closer. Okay, very good. So normal accommodation and convergence, okay? I also saw a direct and a consensual pupillary response, which are normal or expected findings. Okay, the next thing I want to do is test your extraocular movements. I want you to follow the tip of my finger as it moves. Okay. This is testing cranial nerves 3, 4, and 6, otherwise known as the conjugate gaze test. Okay. We're going to test 2 by looking at this chart back here. Okay. I want you to tell me the smallest line you can read out of this line size, and this size. Can you read this?
Yes. Muscle injury.
Okay. Can you read any of these smaller lines?
I can see the letters, but I can't quite read them very well now.
What about this bolder print down here? Are you able to see any of this?
Yes, I can see it. I can make out PhD, but that's
okay.
fine.
Okay. Very good. All right, that's good. So that represents our Snellen eye chart, okay? If you had 20/60 vision, that would mean that you could see at 20 feet what a normal person with perfect vision could see at 60. Okay, so that concludes the visual or the eye portion exam. If I had a ophthalmoscope, what I would do now is, since we don't have one, we'll just verbalize what we would normally do.
Okay.
I would take it out here at an angle, okay, and I would visualize the red reflex in your eye. And I would move in closer, and I would actually try to then visualize those structures of the eye. I would look, I would take the red reflex end up trying to visualize the optic disc, I'm looking for normal vessel size. I'm looking for any evidence of papilledema, and I'm just trying to view the optic disc and the cup and make sure the structure of your eye are normal through a fundoscopic exam. Okay?
Okay.
Thank you.
Thank you.
Okay, now we're going to move on to an examination of your ears. Okay, I'm going to have to kind of pull your hair back, if you will. Yeah, very good. Okay, so I'm just going to first look at the external structures here. I'm going to kind of palpate the auricle and the tragus and the mastoid area. Tell me if you feel any tenderness here when I do that. Good on both sides?
Mm-hmm.
Okay. No lesions, no evidence of trauma to either ear. Okay. I'm then going to just look at the kind of external canal here. I'm looking for increased cerumen. I'm looking for any discharge, any lesions, any swelling or trauma, any foreign bodies. I see none. Okay, I don't have an otoscope today, but if I did, I would kind of do the same thing. I would insert it here into the ear, and I would be visualizing these structures of the tympanic membrane, looking for its normal color, which would be pearly gray, looking for a couple of landmarks, such as the pars flaccida and the handle of the malleus, and I would be looking for any evidence of perforation, which I hopefully would see none.
Mm-hmm.
Okay. The next thing I'm going to do is just a hearing test. Before I use this tuning fork, however, I'm going to whisper a few words in one ear while I disturb the sound by rubbing around the tragus of this ear. Okay, so I want you to repeat these combination of letters and words, letters and numbers to me when I'm finished. Okay.
3Z4.
Very good. And on the opposite side?
16D.
Okay, very good. All right. And then, if we saw any evidence that you missed a number or letter, we would proceed to the tuning fork test. Okay, so what I'm going to do first is the Weber test. I'm going to put this in the frontal area of your skull. Tell me if you hear the sound stronger in either ear, or is it equal?
Equal.
Equal on both sides?
Mm-hmm.
Okay, very good. That's a normal or expected finding. However, if that was not the case, we could further deduct where the loss occurred and what type it is by doing the Renai test. So what I would do then is I would strike the tuning fork. I would hold it back here on your mastoid process, and I would wait for you to tell me that you can no longer hear this, okay? Tell me when you can no longer hear that.
No longer here.
Can you hear it now?
Oh, yeah.
Okay, very good. Same thing on the other side, mastoid process. And what we're looking for is that the air conduction is indeed greater than the bone conduction. Tell me when you can no longer hear it.
No longer here.
What about now?
Yeah.
Okay, very good. Those are both normal or expected findings, showing no evidence of hearing loss. Okay?
Mm-hmm.
Okay, now I'm going to look at your nose. Okay, so what I'm looking for, first of all, just any symmetry or deviation, any foreign bodies or trauma that I can see here in the lower nair. I'm going to look for patency. I'm going to ask you to breathe in and again. Okay, I don't have an otoscope again with me, but if I did, I would put the largest speculum available on it, and I would visualize the internal structures of the nairs here. So what I would be looking for is any deviation of the septum. I would be looking for any discharge, lesions, swelling. Normal color, I can even see that you're nice pink nairs. Okay, I can see the middle and the inferior turbinates. Okay, those are all things that I would be looking for with the inspection of the nose if I had an otoscope. Okay, next I'm going to be looking at lips, the teeth, the inside of your mouth. Okay, we're going to be doing some cranial nerve testing while we do that. Okay, so I'm just looking at your lips just for general symmetry, any lesions, any abnormalities. Okay, with my glove hand, I'm going to ask you to open your mouth. Show me your teeth first. I'm going to be looking at your gums here. Looks great. Okay. Yeah, stick your tongue out for me. I'm going to be looking here at the side. Okay. Normal buccal mucosa. See the frenulum here. Everything's pink and moist. Okay, everything appears to be intact. Stick your tongue out real far for me. Say ah. I see the soft, okay, very good. I see the soft palate and the uvula rise in their midline. That tells me that cranial nerve 9 and 10 are intact. Okay. Now, if you can stick your tongue out for me one more time, I'm going to ask you to go up and down with it, side to side. I'm going to push against my finger here and this way. Okay, and that tells me cranial nerve 12 is also intact. While we're here, I'm going to take these off, and I'm going to ask you to do a couple things to test cranial nerve 5 and 7 before we move away from the area of the mouth. I'm going to ask you to clench your jaw here, palpate the masseter muscle. Okay, very good. And then I'm going to ask you to open your eye real wide for me. Look straight at my nose. Touch that wisp. Okay. Corneal reflexes are intact on this side. 1, 2. Okay. Sorry about that. That's uncomfortable. Then I'm going to ask you to close your eyes. I'm going to ask you to distinguish whether it's a soft or a sharp touch. Okay. So sharp or light touch?
Sharp.
Okay.
Sharp. Light. Light.
Soft, yes.
Soft.
Okay.
I think that one was hard.
Let's see here.
Sharp.
Yes.
Soft.
Okay, very good. So that tells us that cranial nerve 5, the 3 areas of the trigeminal nerve are intact. Okay. And then, if you will, I just want you to smile for me, frown, raise your eyebrows real high. Okay. Puff your cheeks with air. Very good. Now let me push it out. Pucker your lips together. Okay, and then close your eyes real tight. Don't let me open them. Okay, very good. And that shows us that cranial nerve 7 is grossly intact. Okay, now I'm going to be looking at some of the structures in your neck and your throat, specifically your trachea and your thyroid gland. So if you extend your head back slightly, I'm just looking at the trachea here, seeing that the spaces are even, looking for any abnormalities, okay, which I see none, it's midline. I'm also going to try to find now your thyroid cartilage and then your cricoid cartilage. I'm going to move around to the back and actually try to palpate the isthmus of the thyroid gland. Here, you can put your head in a normal position. Okay, and I find the isthmus. I'm going to displace the tissue to one side where I can actually palpate the sides of the thyroid gland. Okay, no enlargement, normal consistency, and it appears to be midline and symmetrical. Thank you.
You're welcome.
Last thing that we'll do with the head and neck area is we'll test cranial nerve 11. So I want you to shrug your shoulders against my hands, okay, to test the strength of the trapezius. I would like for you to turn your head to the left against resistance to this hand, to the right against this. So that tests the strength of the sternocleidomastoid. Both those are normal, and cranial nerve 11 seems to be intact. Okay, now we're going to begin the respiratory assessment. Okay, so what I'm looking for, first of all, is just your rate of breathing. You seem to be breathing normally with a normal rate and rhythm, no increased effort, no accessory muscle or abdominal muscle use, no intercostal retractions. I'm also looking at the anterior posterior diameter, which appears to be normal for you. I'm looking at general color and temperature again, mobility, turgor, looking at the skin to see if it's free from bruising, from nevi, from lesions, from nodules, okay? And just everything seems to be symmetrical, normal, and that's what we want, okay? So now I'm gonna palpate for the chest expansion, okay? What I want you to do is take a deep breath in and then out. Okay, again. Okay, normal, equal chest expansion bilaterally. When I touch my hand to either side of your chest wall or your the back here, I want you to say 99, okay?
99.
Again.
99. 99. 99. 99. 99.
Okay, very good. And then tell me if this is tender, okay?
No.
What about this?
No.
Okay, so looking for costovertebral angle tenderness now, and that is negative. Also, the test for tactile firmitis is normal. Now I'm just going to oscillate over the different lung fields, okay? First, the bronchial breath sounds. When I touch my stethoscope to you, I want you to take a deep breath in and out. Okay, and again. Moving down, where I'll expect to hear the bronchovesicular. Again. Again. Okay, now I can hear the vesicular breath sounds in the lower lung lobes. Again. Okay. No adventitious sounds can be heard. It's clear and equal bilaterally. And no wheezes, no crackles, no rattles, okay? And I'm gonna do the same thing in the front, just looking at your symmetry, which I've already done, and the just the symmetry and any abnormalities in the skin, I don't see any that are present. Okay, I'm gonna auscultate the anterior lung fields, okay? So each time I touch stethoscope, take a breath. Again, listening for the bronchial sounds here. Moving down, bronchovesicular. Gonna probably put this under your bra slightly. On the side. Okay. Again, the vesicular sounds. Again, clear, no adventitious sounds noted. Everything seems to be normal with your lung sounds. No crackles, no wheezes, no rails, no rockerous sounds. Okay?
Thank you.
Thank you. Okay, now we're going to begin the general assessment of the cardiac system. Okay? So what I'm going to do is just begin to auscultate the different points of auscultation over your heart. So what I can do here is I can come down and find the sternal angle, which connects here to the second rib. Go slightly below that, and I can feel the second intercostal space. And right there at that right sternal border, second ICS or intercostal space is where I will begin to auscultate the aortic point or aortic valve of the heart. Okay, moving over here to the left sternal border, second ICS, will be the pulmonic sounds will be able to be auscultated with the diaphragm. Moving down one to the third ICS, left sternal border, Erb's point. Okay, switching to the bell here and moving down to the fourth ICS, I may have to slightly display some of your breast tissue. Fourth ICS, left sternal border, be the pulmonic sounds, which are easily auscultated with the bell. And then I'm going to move down to the fifth ICS, mid-clavicular line, displace the breast tissue upward, and I'm going to listen here for the mitral valve, mitral sounds at the apex of the heart, or the point of maximal impulse. Now I'm going to auscultate for 1 full minute. I've already begun the counting, and count your pulse rate. Okay, we've been a minute, and we have a pulse rate of 62. Now what I'm going to do, now that we've auscultated that, I'm going to try to just palpate that point of maximal impulse with you sitting. So what I'll do is start off with 2 fingers till I can try to locate it here. Maybe lean forward slightly. And then I'll take it down to 1 finger. Very strong PMI, easily palpable there. Okay, now I'll just have you lay back and we'll repeat these tests. Okay, now we'll continue the cardiac assessment with you in the supine position. So what I'm looking for first of all is any heaves or lifts, which I see none. I'm also going to palpate over each point. I'm going to try to see if there are any thrills associated at each point. So aortic, no thrills noted. Moving over here to the second ICS left sternal border, pulmonic, no thrills noted. Third ICS left sternal border, Erb's point, no thrill. Tricuspid, no thrill. And then seeing again if I can palpate the PMI, but looking for the absence of a thrill. Can you roll over to your left side slightly for me? Just a little further. Okay, perfect. And I can palpate the PMI, but no thrills are noted. And if you will slide up into the pillows just slightly, okay? Just leave it there in your head back. I'm going to auscultate, and then I'm also going to look for jugular venous distension. But first, we're going to repeat the cardiac auscultation. Aortic, pulmonic, Erb's point, Flipping over to the bell, tricuspid, mitral. Okay, so supine and seated, S1 and S2 heart sounds are audible. No clicks, murmurs, or gallops can be auscultated. I'm just going to look with you lying here in this position. First, I'm going to palpate the carotid arteries. Easily palpable on the left and the right. I'm going to go back to the bell here. I'm going to listen for any bruits. No bruits can be auscultated. Also, there are no signs of jugular venous distension in the 30-degree supine position. Thank you. Okay, now I'm going to begin with the assessment of your abdomen, okay? First, I'm just looking again at the skin, general appearance, color, normal temperature, normal moisture, no edema, no swelling, no abnormalities, no lesions, no nevi, no scars, no apparent bruising, color normal for ethnicity. Okay, then I'm just kind of looking around your umbilicus, seeing that there is no Cullen sign, which would be bruising around the umbilicus. I'm looking for peristaltic waves or any, visual movement of the bowels, of which I see none. Okay, and just looking at the general symmetry and everything. Next thing I'm going to do, now that I've looked at the contours and symmetry, I'm going to auscultate over the aorta. I'm going to listen for bruits at the aorta. Moving out to the renal and iliac arteries. I'm going to auscultate down here by your femoral artery, okay? On both the left and the right. First, palpate the femoral artery. Okay, going to flip to the diaphragm. We're going to listen in all 4 quadrants for bowel sounds. Present immediately in left upper, right upper, right lower are present, and left lower. Very good. Okay, now I'm going to percuss in some different areas of your abdomen. I'm just going to be listening for sounds, resonance versus tympany versus dullness. Okay, you can start here. We can go ahead and find the lower border of the liver here. Get the change in tone, the dullness, back to resonance. So it appears that the liver span will be between 6 to 8 centimeters there, which is normal. I'm going to palpate over here. Near the spleen, splenic area of dullness. Tympanic and slightly tympanic, but more resonant sound here over the other areas, quadrants of the abdomen, which is a normal or expected finding. Okay, now I'm just going to palpate lightly, just going to feel around in here, looking for any swelling or any anomalies there. Okay, just light touch. I'm going to go a little deeper now, and you tell me, try not to tense up. Let the abdominal wall move slowly, or just move freely. Any tenderness when I do this? Okay. No guarding here. I'm going to look for a little rebound tenderness over McBurney's point. Deep breath in. And when I let go here, any tenderness? Okay, good. So negative for McBurney's point. Now I'm just going to listen as we do this scratch test over the liver. Okay, we can clearly demarcate the border of the liver there. Now from the top. Okay, so we can more closely estimate the actual span of the liver with that technique. Okay, now 2 things I want to do, 2 simple tests. First is going to be the psoas sign. This will be for appendiceal irritation. I want you to raise your leg against my hand, against resistance. Any tenderness in this area? Okay. Second will be the obturator. I want you to bend your leg slightly to the hip. And when I move it in, any tenderness redness in the abdominal area?
No.
Okay, very good. So negative psoas and negative obturator sign, which shows that there's very likely no appendicitis or appendiceal irritation. Thank you.
Thank you.
Okay, now we're going to begin the musculoskeletal and extremity examination. Okay, the first thing we're going to do is just kind of start looking at some of your joints, looking for any swelling, looking for any deformity, any nodules, kind of going through the range of motion, trying to feel for any crepitus. Just kind of a general overview of some of the major joints here, where we would see some of that stuff present. Okay. I'm going to look down here at your knees now. Can you bend the knee for me? Okay. Feeling for any crepitus here. And then I'm just going to start feeling for some pulses here. I'm going to try to palpate your brachial artery. Okay. Radial. Again over here. Okay. All right, very good. Twos on all around. Let's feel the dorsalis pedis. Posterior tibial. You can leave that one dependent. I think we can palpate it better. Posterior tibials are graded at a 1. I would say the dorsalis pedis are 2. 2's at the radial, 2's at the brachial for your peripheral pulses. Okay, let me see the hands here. I'm going to do a simple capillary refill test. Okay, pretty brisk, about 2 seconds there. And between 2 and 3 seconds on the toes. Okay, next we're going to do some range of motion and strength testing at certain portions of your joints. Okay, so first with the neck, I want you to go down, flexion, and then back if you can, extension. I'd like for you to turn your head first this way. Okay, rotation, and then what about lateral bending? Can you do this? Okay, any pain or discomfort doing that?
No.
Okay, let's go ahead and do the spine while we're there.
Okay.
Can you lean forward and touch your toes or go over as far as you can for me? I'm also kind of going to look for, okay, very good, deviation there, looking for scoliosis. And then if you can, I want you to bend back with me as far as you can. I'll be here, I won't let you fall. Okay, very good. Now, can you rotate like this and to the other side? To the other side. All right, and then let's do the lateral bending. Let's go to the side here. And again that way. Very good. Okay, moving on to the shoulders. First thing I would like for you to do is come straight up. Okay, here I'm going to check your strength. Can you, okay, continue upward all the way. Okay, flexion and then come back down. Okay, push against resistance here too. All right, very good. And then come all the way back. All right, very good. Okay, now what I would like for you to do is straight out. Let's do around, circumduction. Okay, now I would like for you to do adduction here, and then if you can, push against my arm. Very good. Same thing here, go across, push against my arm. Very good. And then if you can, I would like for you to reach back. Are you able to scratch your back with the back of your hand? Perfect. Okay, what about the other side? Okay, very good. Okay, now, if you can, I would like for you to take your elbows, bend them here, okay, push down, and then pull back against resistance. Very good. Okay, and then straight out with the extension. Okay, what about the wrist? Can you show me your wrist like this? I'd like for you to go down, back up, okay, like this. Okay, a little hyperextension. Can you flex them like this? Straight out. There we go. Okay, now fingers. Can you deviate your wrist in this way? No, just your wrist. Okay. What about out like this? Okay. Now fan your fingers out in extension, flexion. Can you do this? Okay. Can you squeeze my fingers? See your grip strength? Okay. Now can you put your finger out here? Now just put your hands like this. Release a little bit of the tension. Okay. Can I identify the anatomical snuff box here? Okay. What about this? Can you rotate your wrist around? Very good. Okay. Can you have a seat down here for me?
Yes.
Okay, and now I'm going to have you flex the knee here, and then extend this leg. Okay, same thing on the other side, if you can. Okay, very good. And if you can, I'd like for you to bend your ankles back towards you, okay, and then pull against my hands. Very good, and then point them towards me, push, good, good. Can you rotate them internally both, and then externally? Are you able to kind of move them in a circle at all? All right, very good. Okay, now we're going to do a couple of specialty tests. The first one's going to be called, keep your legs straight for me. It'll be the varus valgus. Okay, so I'm going to put a little medial stress here. Okay, and move to the other side. Okay, what I'm assessing there is the medial and the lateral cruciate ligament. Any pain when I do that? Okay. What about here? Okay. All right. Now the drawer test. I'm gonna come right here. I'm gonna pull. Okay, and then push. Okay. Same thing on the other side. Okay. And let's look at the anterior and the inferior cruciate ligament as well. Okay. Now, if I could, I'm going to have you stand back up. We're going to do a couple of other specialty tests. The first thing I want you to do is I want to put your hands together like this, kind of curve your fingers. We're going to watch this for about a full minute. This is known as the valence test. This is detecting possible carpal tunnel syndrome. Okay. Okay. Any numbness or tingling, discomfort in the wrist?
No.
Okay. Very good. Then we can go on to the tennels, which I would like to see right here. I'll tap on the median nerve. Any pain there when I do that?
No.
On either side?
No.
Okay. Now a couple other things while you're standing in this position. We'll do some testing for a supraspinatus muscle or tendon tear. I want you to let your arms go limp. When I let go, I want you to lower them slowly to your side. Okay. Drop arm test. So that's good. You wouldn't have been able to maintain that. You would have gone and dropped quickly if you had a tear. Next thing I want you to do is this angle. I want you to kind of point your thumbs up. Okay. I want you to, first with this arm, pull up against the resistance, okay? Same thing over here, okay? And then if you'll pronate your forearms there, same thing, pulling up against resistance, okay? Okay, so that's our empty and full can test for supraspinatus tear, which are both negative. Good signs, thank you.
Thank you.
Okay, so now we're going to begin the neurological examination. The first thing I'm going to do is assess some of your deep tendon reflexes, okay? So first I'm going to start with the biceps reflex. Just kind of relax your arm there, as it is. Okay, very good. I'm going to strike here behind the elbow. This would be the triceps. Very good. And the brachioradialis, okay? Perfect. Nice brisk response, which is what we expect. Kind of let this arm. Okay. Then here. Okay. Slide your watch down. Brachioradialis. Can you slide your watch down for me?
Yeah, of course.
Okay, perfect. And slightly. Okay, very good. Now we're going to do patellar reflexes here. The knee. Okay. Okay, very good. And then the Achilles reflex. Perfect. On the right. Yeah, perfect. It is intact. Could you lay back for me just for a moment? Okay. And now I'm going to stroke up on the foot here. Okay. No Babinski fanning, so that's a normal response. And I'm going to flex the ankle here, okay? I'm going to a couple times and then real rapidly, okay? Looking for any ankle clonus, of which I see none. Okay, you can sit back up on the edge. Okay, now I'm going to assess your sensation of light and sharp touch, okay? Again, like we did earlier on the face, but now on the upper extremities, just close your eyes for me. Tell me if this is sharp.
Sharp. Sharp.
Okay.
Light.
Okay.
Light, sharp,
Okay. Straighten your legs out for me.
sharp, 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 light, 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 sharp, sharp.
Okay. Very good. And then, if you will, just keep your eyes closed. Open your palms here. We're going to do a test for graphesthesia, which is what I want you to do is tell me if I'm tracing a particular shape or number. We'll start with a number in the right hand.
8.
Okay. What about a shape over here?
Triangle,
And a shape here.
circle,
All right. And let's try a number over here.
2.
Perfect. Very good. Okay, and if you can, I want you to put your hands out just like you had them a moment ago on top of your knees. And very rapidly, I want you to alternate between supination and pronation. So like this. Just kind of pat them on your quickly as you can. All right, very good. Okay, and if you could just stand up for me. All right, I want you to hold your hands out in front of you like this. And I now want you to keep your heels, kind of touch your heels together there. And then for a full minute, I want you to stand here with your eyes closed. Okay? Okay, you can open your eyes now. And that was a Romberg and then a pronator drift test to kind of test your cerebellar coordination and also your proprioception. Okay, so now what I want you to do is come right over here. And I want you to do just some heel to toe walking right here in front of me, okay? Yep. And then now switch and walk on your heels. Okay, can you turn around and walk towards me on your toes? This is again testing your proprioception. Okay, and then if you could just take a seat back one more time. And I would like for you to do heel to shin. Yep, all the way down. Trace your shin with your heel all the way down to your foot. On the other side. And then back up. Okay, very good. Very good. Okay, thank you very much. This concludes our physical examination. I appreciate your time.
Thank you.
All right.